This is the part 2 of an update on COVID-19 vaccines in children. Previously, I have given an introduction about COVID-19 in children and the clinical trials of the vaccines done so far in children and adolescents. And here I will talk about the safety aspects, regulatory authorization, current global situation, and is it a fair process? So most experts believe that the vaccines that are currently available are safe for adolescents. That is, the clinical trial and real-world data have so far been reassuring in the studies that have been done. Children less than 12 years are in a key stage of growth and development. We have to remember that. And therefore, any vaccine effect should be monitored very closely over a long period of time. There's been a potential link of myocarditis and pericarditis with the Pfizer vaccine. However, it's still to be established that the vaccine caused the inflammation, because we know that myocarditis can be caused by other viruses and some medical treatments. Myocarditis is inflammation of the heart muscle. Myocarditis and pericarditis risk has been found to be extremely low post-vaccination for COVID. When you look at the all-age group data, 1,226 cases were reported in 300 million doses of Pfizer Moderna vaccine that were given. In the 16 to 19 age group, it was 217, and the younger children, it was even a smaller number than that. The incidence is higher than expected in young males. That has come out clearly, and almost all made full recovery, and there were no deaths. So these are the safety perspectives with regards to vaccines in children. If you look at the regulatory authorizations that have come so far, Canada was a very early country to authorize the vaccine on the 5th of May, and they authorized the Pfizer vaccine in children 12 to 15 years of age. The FDA followed quite soon after on the 10th of May, where they gave an emergency authorization for children between the age of 10 to 15 years. The EMA provided authorization on the 28th May for the Pfizer vaccine, and then on the 23rd July for the Moderna vaccine between the age of 12 to 17 years. MHRA in the UK authorized the Pfizer vaccine for children between the age of 12 and 15 in early June, as it was already approved for those 16 and 17-year-olds from previously. So most of the important regulatory bodies have authorized the vaccine. And when it comes to China, the Sinovac and the Sinopharm vaccine has been authorized for those between the age of 3 and 17 years. The WHO Strategic Advisory Group of experts have also indicated the Pfizer vaccine is suitable for 12 years and above. So several bodies have authorized this vaccine for adolescents. What is the current global situation? China was the second country to approve the Pfizer vaccine for children, because Algeria had authorized it in April and was using it in children. And this has already been rolled out both in Canada and the US, where all those over the age of 12 years are offered the vaccine. US has the most experience in this area at present. The CDC reports from the 22nd of July this year that almost 7 million children or adolescents between the age of 12 and 17 years have been fully vaccinated. That is 2 weeks after the second dose. Greater than 30% of this group would have received the vaccine and been fully vaccinated in early August when they start school, because that is the target that the US is going for. The most frequently reported adverse effects was pain at the injection site, fatigue, and headache. The side effects were slightly less common in 12 to 15-year age group when compared to the 16 to 25-year age group. What about Europe? At present, 20 countries are vaccinating those aged 12 and over or are planning to do so in the very near future. 6 countries have decided to initially offer the vaccines to children with underlying health conditions, and the UK is one of these countries. So when it comes to the UK, the Joint Committee on Vaccination Immunization very recently recommended that 12 to 15-year-olds who are at very high risk of becoming severely ill with COVID-19 receive the vaccine. That is, children with severe neurodisabilities and those with underlying conditions that result in immunosuppression. In addition, children between the age of 12 and 17 who live with an immunosuppressed person were also to be offered the vaccine. So we have looked at Canada, US, Europe, and the UK, but about the other countries. Singapore, Japan, Israel, China, Hong Kong, Philippines, and the UAE are all vaccinating children over the age of 12. China is offering the Sinovac and Sinopharm vaccine between the age of 12 and 17 and hope to vaccinate this group by September or October. So we have looked at the current global situation, and the question that is asked is it fair? Is this whole process of vaccinating children and adolescents fair? Why is this asked? Because we are vaccinating children who are getting mild disease to prevent transmission to adults and the wider community. We're still understanding the side effects and the long-term effects in children. So these are the arguments put out. In addition, many countries are struggling to control the spread of SARS-CoV-2. That's limited global supply of vaccine. And in certain countries like Peru, Colombia, Paraguay, less than 30% of the population have received even one dose of the vaccine. And these same countries have the highest COVID-19 death rates. So WHO has taken a position that it's less urgent to vaccinate children between the age of 12 to 15 unless they are part of a high-risk group. In fact, the WHO Director General in May said that prioritization of low-risk groups such as children in rich countries is a moral catastrophe. And he wanted the countries to reconsider the position and donate the vaccine to COVAX so that more critical groups in certain countries in Africa and Asia would be able to access this vaccine. However, there's a counter-argument given indicating that children are losing out a lot by not being able to go to school and follow their face-to-face learning and other activities. And the counter-argument is that the number of doses needed to vaccinate the children is not so high to compromise other processes of vaccination around the world. So these arguments have been going to and fro, and different countries have decided to vaccinate either all children over the age of 12 or selected groups of children. So in these two presentations, I have discussed you aspects with regards to COVID-19 in children, the clinical trials that have been reported as of this date with regards to Pfizer vaccine, Moderna, the Sinovac and the Sinopharm vaccine. I've looked at the safety aspects and including touching a bit on the myocarditis, pericarditis data. I've spoken to you about the regulatory authorization, the current global situation, and also touched on, is it a fair process as this debate is raging at the present moment. Thank you very much.